Well, hello, everyone, and welcome. My name is Christine West, Project Director,
I'm Alex Laferriere, the Outreach Coordinator.
and we are the Healthcare System Transformation Project at the Rhode Island Commission on the Deaf and Hard of Hearing. For those of you who are unaware, the Rhode Island Commission on the Deaf and Hard of Hearing is an independent state agency. It's located on Capitol Hill, right across from the State House in Providence, Rhode Island. The Commission is an advocating, coordinating, and service-providing entity committed to promoting an environment in which deaf and hard of hearing individuals in Rhode Island are afforded equal opportunity in all aspects of their lives. The Commission is an independent state agency reporting directly to the governor. It is governed by a board of commissioners, 11 in total, 5 of which are deaf and use American Sign Language to communicate, one of which who is deaf and does not use sign language, 3 individuals who are hard of hearing, and 2 individuals that are hearing. The agency has been charged with 9 legislative mandates. That includes administering an interpreter referral service for the state of Rhode Island. That also includes lobbying for legislation and improving the quality of life for deaf and hard of hearing people in Rhode Island, among other things. The agency has 4 full-time staff and 4 contractors. Their website is www.cdhh.ri.gov. We encourage you to take a look at their website to learn a little bit more about this state agency. Now, I'd like to talk a little bit about the rationale of this project and how it came to be. For those of you who are unfamiliar with deaf and hard of hearing individuals, you may not know that there are several inequities in access to healthcare, and this is due to a lack of language concordant medical professionals and qualified American Sign Language interpreters. In their research, disparities are noted in health outcomes for the deaf community, and this is due to the lack of access of healthcare, lack of access to health information, education, and economic resources. For the deaf community, they're more likely to seek services in the emergency department than to see a primary care physician. As a result of this, the Executive Office of Health and Human Services granted the Commission a grant in the amount of $646,000 for the purpose of a healthcare system transformation project grant. And this was to improve access of deaf and hard of hearing individuals in the state of Rhode Island. The project has 3 main goals. First is data collection. Second is workforce training. And third is workforce development. Next, I'll turn it over to Alex to talk a little bit about our first project goal, data collection. Alex?
So when this grant project started, we wanted to get a baseline of what sort of data existed for deaf communities locally here in Rhode Island and as well as abroad in the nation. We found survey data that was collected over the course of 20, 30 years. A lot of it was paper surveys, and we found surveys in California that were administered as sort of our initial step, which influenced our survey creation. We wanted to administer these surveys for both the deaf community of Rhode Island as well as healthcare professionals, and we'll get into a little bit of what our results were in regards to the deaf community.
Thanks, Alex. So the first survey that we developed and disseminated was for the deaf and hard of hearing community here in Rhode Island. Recognizing that we wanted to work with researchers who were deaf themselves as they represented the population that we were surveying, we elected to partner with an external institution, and that was Gallaudet University in Washington, D.C. That university is the world's only 4-year liberal arts college for deaf and hard of hearing individuals. And as such, they have a Center on Deaf Health Equity that specializes in health surveillance of deaf individuals. Working with Gallaudet University, we were able to create the first online bilingual American Sign Language English survey that was disseminated to the deaf and hard of hearing community in the year 2020. Results were collected, and we have that information available on our project website. And so we hope that you'll take a look in order to find out health outcomes, barriers to care, and other information that we asked as a part of that survey. Next, I'll turn it over to Alex to talk a little bit about the survey for healthcare professionals.
So this is critical to mirror the deaf community data with our healthcare professional data. And we surveyed 20,000 healthcare workers in the state of Rhode Island, and we returned about an 8% response rate, which gave us a deeper insight into the current climate of healthcare workers, their understanding of both resources and services within the state, and their perspective and understanding of the deaf community, whether they're serving them or not. And as Christine mentioned, this was also done digitally, and also worth mentioning that it also happened during the COVID pandemic. For better or worse, our surveys were disseminated statewide and digitally as well, which I thought was a huge plus and a huge strength, as opposed to a lot of the paper surveys of the past, which were only conducted in written English. So this was very accessible for the deaf community, and also accessible to healthcare workers in terms of their time and attention being done on a digital platform. And again, all of this data can be found within our project results on our website as well too.
So our second project goal was workforce training. And this included 3 different components. The first was a video testimonial campaign, which Alex will talk about in just a moment. This also included a virtual spotlight series of deaf healthcare professionals, as well as a virtual training series for healthcare professionals. Alex?
So the video testimonial campaign is critical in terms of bringing a voice and bringing sort of a human component to our data. It adds a qualitative sort of aspect to it as well. Members from the community had the opportunity to express their concerns, their dreams, their desires in their own language of American Sign Language on video. And we have a handful, over 10 different videos that we've collected, which represent different facets, from late deafened to long-term deaf community members to children who have deaf parents and also communicate in American Sign Language. So the scope runs the gamut of the deaf community of Rhode Island, which is vital to impacting results here in the state.
Thanks, Alex. Just to add to that, this testimonial campaign was a wonderful opportunity for the deaf community to express what it is that they'd like to see improved in the healthcare system and in terms of their access to medical providers. So we hope that you'll take a look at these video testimonials and really listen to what deaf community members have to say about what they would like to see improved. In addition, we have the virtual spotlight series, which focuses on deaf healthcare professionals. This is a series of interviews conducted virtually with 6 different healthcare professionals who are either deaf or hard of hearing. So these individuals are doctors, nurses, clinical psychologists, dentists, and more. We know that for medical providers, peer-to-peer education is important. And so this is an opportunity for folks to be able to learn more from deaf healthcare professionals themselves, as they have the expertise of being consumers of services as well as providers of services. And next, I'll turn it over to Alex to talk about our virtual training series for healthcare professionals.
So this virtual training series is really the heart of the matter of what we hope to administer today. It runs the gamut from healthcare workers to physical therapists to those that help people who have problems with addiction or domestic violence abuse. And it also spotlights local Rhode Island healthcare workers as well, deaf, hearing, and otherwise. We also want to showcase these training modules as part of our HSTP program. And it has a long shelf life as well too. These virtual trainings are online, are replicable, and also provide information for both the deaf community and healthcare professionals like yourself who are watching this video. So we hope that at the very least, HSTP will have a long shelf life beyond our project while accessing this information year in, year out as new cohorts come in, and as well as for growing and aging deaf populations in the state. And they can access this stuff online on our website as well.
Thanks, Alex. And just to emphasize, this training series is really for you as healthcare professionals to be able to learn how to better serve deaf and hard of hearing individuals in the state. We hope you'll take advantage of them, and we hope you'll enjoy the range of expertise and the quality of information that's included in those modules.
I'll also add that the experts within the videos also provide their contact information. So it's a resource beyond just education. People can actually reach out to them, whether it's yourselves as a healthcare professional, or you can use it as a resource for a deaf patient to direct them to these videos online to better get interaction and better to get information in a language that's accessible to them. And if they want to follow up, they can reach out to these professionals as well.
And our final project goal is workforce development. And this involved the creation of the state's first sign language interpreter training program in partnership with Rhode Island College. As a result, the Public Health and Equity Sign Language Interpreting Program is currently in operation. It is the nation's first sign language interpreting program with a focus on public health and equity. It recently launched this past summer, and the first cohort is making its way through the program as we speak. It's been a huge success in the state of Rhode Island, and the goal is to create a workforce of interpreters that will continue to provide interpreting services in healthcare facilities throughout the state. We know that there is not only a state shortage of interpreters, but a national shortage. And so this program will serve as part of a pipeline to ensure that healthcare facilities have the resources that they need to serve deaf and hard of hearing individuals well into the future. Well, thank you for joining us for our presentation on the Healthcare System Transformation Project at the Rhode Island Commission on the Deaf and Hard of Hearing. If you'd like more information, you can go to www.cdhh.ri.gov/HSTP. You can also find out more information on our social media channels on Instagram, as well as Twitter and Facebook.